ROPAC is the Registry of Pregnancy and Cardiac Disease. It's an ESC-led registry that has been going on for many years now. And it's directed by Jolien Roos-Hesselink, who many of you may know, and Roger Hall. And you can see the members of the executive committee. You can see that Guillaume, who is one of the next speakers, is also on the board. Well, we've been working together for a number of times, and there's been a scheme that has been followed, a structure of the registry, as you can see here. So there's the pregnancy that is followed in these patients, obviously, and then there's a follow-up collect of data at 6 months. And here you can see a more detailed scheme of the data collection with the obvious factors that are registered. So the demography of the patients, the diagnosis, of course, with other concomitant diseases, the obstetric history, the current medication, the events that occur during pregnancy, and then about delivery and outcome. And there's data on the echo, and then, as I mentioned, there's follow-up data that are also discussed. So in total, there's been 138 participating centers, and this was the first part of the ROPAC registry. Initiated in 2007 and going on until 2018. And 53 countries have participated in this registry. You can see it's a worldwide effort. Almost 6,000 pregnancies have been enrolled in this registry, and this has already led to 26 publications. And I want to focus a little bit on publications related to aortic disease, obviously, for this meeting. And this is one of the publications that we have made out of this registry on pregnancy outcome in thoracic aortic disease. So there were 189 patients included. It's a minority, so the registry is about cardiovascular disease, and as has been mentioned, aortic disease is not very common, so it's a minority of the group. As you can see, 100 Marfan patients, 49 BAV, then a number of Turners, a few vascular EDS, and then 20 TADs. Ascending aortic dilatation was documented in 58%, and 11 patients had a history of aortic dissection prior to pregnancy, 10 type A and 1 type B. And 50% of the patients, which is a low number, because the guidelines say other things, were treated with beta blockers. There were no complications, and that's important, I think, in women with a previous history of dissection, and there were 4 dissections registered in this registry. And as you can see, many of them, and this has been reported by many others, this comes out of many data, that dissection during pregnancy is a first presentation in some women of underlying heritable thoracic aortic disease. And this is something that we need to work on and try to avoid that, because of course you're dealing with 2 lives at that point, and yeah, it's something that we need to try to avoid as much as possible. As you can see, the aortic roots in these dissections during pregnancy, 60 millimeters, 55 millimeters. So these were really at diameters that you would have not let go into pregnancy, I'm quite sure. So another publication from the ROPAC registry that is, I think, important is about the mode of delivery. And I see that Melissa is also in the room. I'd love to discuss that with you, if possible, because there's this belief that women with cardiovascular disease benefit from cesarean section. This is something that cardiologists still think is a lower risk and lower stress. But according to the data that were collected, planned cesarean section did not confer any advantage over planned vaginal delivery, a planned vaginal delivery, that is, so don't do anything in an emergency setting, in terms of maternal outcome, but it is associated with an adverse fetal outcome. So, and here on this graph, you can see there's big regional differences in how deliveries are dealt with according to the country. in the general population, and then in the registry. And you can see that there's a markedly increased number of cesarean sections in some countries. It's even more than double. So this is something to consider, and something that a message I think we should bring out, that this may not always be the better solution. And then one very recent publication, also coming from the ROPAC registry, is about the treatment with beta blockers. So as you can imagine, there's a number of women in this registry that receive treatment with beta blockers, and this is it will be in press next month, but it's a paper that will be published, and we were able to look at the different types of beta blockers. So metoprolol, one of the mostly used, bisoprolol, carvedilol, propranolol, labetalol, and atenolol. And perinatal outcomes were checked, so neonatal birth weight, small for gestational age, and then congenital heart disease. And what was interesting that we could do a comparison between these different beta blockers, and not unexpectedly, when you take metoprolol as a reference, there was a worse outcome in the group treated with atenolol. So the conclusions here were that beta blocker use is independently associated with small for gestational age infants. Labetalol has the lowest risk for this event, and atenolol is the highest risk. And then fetal growth scans are recommended. So women on beta blockers, requiring beta blockers, including the ones with aortic disease, should have frequent scans to assess fetal growth. And they should, obviously, and this should be done before pregnancy, so in the counseling process of these women, you need to take that into account and discuss with the patients what the risks and the benefits of the treatment are. So this was ROPAC 1 and 2, so this was the first part, and now luckily the ESC decided to go on with some funding, and we were able to set up a ROPAC 3, and this was based on gaps in knowledge that were defined, and aortic pathology was defined as one of the gaps in knowledge because it's one of the major causes of maternal mortality, and this, along with prosthetic valves, led to the ROPAC 3, which has been going on for the past years, so inclusion has now ended. As you can see, there's even more centers that participated in this ROPAC 3, and there's more than 1,000 pregnancies that were included, and about half of them, so 562 of the patients were with aortic disease. And we are analyzing the data, and I would have loved to present this to you at this meeting, but I'm under embargo. I'm very sorry. So the ESC is starting tomorrow, and these data will be presented in the late-breaking science session on next Monday. So those of you who go to London after this meeting, you're very welcome to come and listen to the data of the pregnancy outcome in the ROPAC study. So I want to end here, and I want to promote a little bit more the ESC that will be going on, but because there's other interesting sessions for this audience. So there's the new ESC guidelines on aortic disease that will be presented in the main session tomorrow, and there will be different sessions